I am Mary Pyfferoen. I'm a physical therapist at Mayo Clinic in Rochester, Minnesota, and I am here with a poster at the American Academy of Physical Medicine and Rehabilitation. I was involved in doing a poster along with several of my colleagues, and those colleagues included several physical medicine doctors in addition to several occupational therapists. The title of my poster is Inpatient Rehabilitation in Patients Receiving Left Ventricular Assist Device Therapy. We participated in a retrospective medical record chart review where we looked at the medical records of 94 patients, and they received LVADs at Mayo Rochester from January 1st, 2008 through June 30th, 2010. When we looked at the charts, we looked first to see where we first looked at 97 charts, and of those 97 charts, 3 people were actually being reimplanted, so they fell out of the study. So that left us with 94 patients that we looked at. So we had 94 patients admitted to the acute care hospital, St. Mary's Hospital in Rochester. Of those 94 patients, we had 10 patients who died in the acute care side of the practice. We also had 84 patients then left. Of those, we had 34 patients who dismissed directly from the acute care hospital home, and then we admitted 47 patients to our acute rehab unit. After this, we then went and we looked at the functional independent measure scores for the patients that were admitted to the rehab unit. What we found is that there was improvement in all areas of the FIM, with the exception of bowel. There was a small increase in bowel training, but it wasn't statistically significant. The other thing we did was we compared the demographics of the patients that did not go to the rehab unit and the patients that did go to the rehab unit. What we found is that patients that were admitted to the rehab unit were much sicker and had more comorbidities than those that were not. So essentially what we concluded is that 50% of the patients receiving LVAD therapy require inpatient rehab before discharge to home. Older patients, those who require VAD implantation as destination therapy, and those with greater Medicaid complexity are more likely to require inpatient rehab. And individuals admitted to the Inpatient Rehabilitation Center following an LVAD implantation have a significant improvement in functional and cognitive status as measured by the FIM. And so now we are recommending inpatient rehab as a consideration for patients that have an LVAD placed.